If you've got kids, you know that coughs and colds can feel like a revolving door. One ends, another starts. Here's the thing though, most colds are viral. They get better on their own and they don't need antibiotics. So today I want to share exactly what I do at home when my own kids are sick with a cough or cold symptoms from infancy through school age. Let's dive in. Let's start with my number one tool, saline. Saline works like a rinse cycle for your child's nose and can be used on kids as young as newborn babies. Think of it like giving their nasal passages a little shower. It thins out mucus, moistens the nasal passages, lowers cough triggers, and can even slow down viral replication. All of this means your child can breathe easier, sleep better, and maybe even cough a little less. So what's actually happening when you use saline? When a child has a cold, the lining of their nose gets swollen and produces extra mucus. That mucus traps germs, but it also makes it hard to breathe. Saline helps by restoring balance to the mucus layer and cilia, those tiny hair-like structures that sweep out debris. It keeps that system moving smoothly instead of getting clogged and sticky. Saline also helps wash away viruses and allergens sitting in the nasal passages, which means there's literally less virus hanging around to multiply. Some studies show that saline can even create a slightly less favorable environment for viruses to replicate because it improves the nose's natural defenses, like mucociliary clearance and hydration of the airway lining. I reach for regular isotonic saline, that's the regular saline you get over the counter, because it's gentle enough for everyday use. That is 0.9% saline. Hypertonic saline, the saltier kind, usually 2 to 3%, has also been studied. That study found that kids who used hypertonic saline shortened their colds by about 2 days and used fewer cold medications. Pretty cool, but it can sting and most kids don't love that. For everyday use, I keep it simple with regular saline. It's easy to find, well tolerated, and while we don't have as many studies on isotonic saline specifically, the physiology tells us the benefits are there. Moisture, movement, and clearance. That's the trifecta for helping those little noses feel better. At home, I usually keep saline sprays or drops, boogie wipes for gentle wiping, and a saline mist inhaler for a deeper rinse. My go-to rule, saline drops or spray if the congestion is bothering them enough to sleep or eat, and definitely a spray before bed for comfort. Saline helps loosen things up, and most of the time, that's all you need. Suction is only for backup. I only use it when saline spray alone doesn't help and my kids are still really stuffed up. Too much suctioning can actually irritate the nose and make things worse, so don't go suction happy. And if you've got a toddler, sometimes the best trick is to let them spray the nasal spray itself. It gives them that sense of control and they're way more likely to cooperate. And hey, if you're finding this helpful already, don't just blow it off like a sneeze. Hit that subscribe button so you can keep catching these tips every week, including my awesome puns. Being sick doesn't just make you stuffy, it makes you cranky and achy. For my kids, I use ibuprofen when they're uncomfortable, whether they have a fever or not. Ibuprofen helps with sore throats, ear pain, muscle aches, and general discomfort. We call it liquid gold in our house because it really can help perk up a miserable kid. And here's the science in simple terms. When your child is sick, their body makes chemicals called prostaglandins that cause pain, swelling, and fever. Ibuprofen works by blocking those chemicals, so it's not only bringing down fever, but also helps ease pain and inflammation. Acetaminophen, on the other hand, mainly works in the brain to lower fever and pain, but doesn't do as much for inflammation. That's why ibuprofen often can help more when kids have sore throats, ear pain, or viral body aches, because it's attacking the inflammation. Ibuprofen also lasts longer, usually 6 to 8 hours compared to acetaminophen's 4 to 6. I prefer ibuprofen once a baby is over 6 months. Before that, it's not recommended because young babies' kidneys aren't ready to process it well. When my son was a baby, he didn't get sick until around 14 months. Thank you, pandemic isolation. My daughter, though, caught COVID at 4 months and was miserable. So I used acetaminophen at that stage since it was safe for her age. Now that they're older, I give ibuprofen when they seem unwell or cranky from being sick. I'll usually give it before naps or bedtime if they're due for it. It helps them sleep more comfortably. For my son, who can tell me how he feels, I'll ask if he wants the medicine before he sleeps. Most of the time he says yes because he knows it helps. And for my daughter, I go by cues. If she's clearly uncomfortable, I'll give it. The main rule here, follow the dosing on the package and don't give it too often. More isn't better. The goal is comfort, not overdosing it. And if you want to learn more about acetaminophen versus ibuprofen, I'll link another video that breaks it all down. And since we're talking about things that make your life easier, subscribe. It's like the ibuprofen of YouTube, keeping things smooth around here, and liquid gold. Next up, our family's comfort remedy, golden milk or haldi doodh. It's warm milk with turmeric, black pepper, and honey for kids over 1. The turmeric contains curcumin, which has anti-inflammatory and antioxidant properties. It helps calm irritation in the throat, chest, reduces inflammation, and supports the immune system. The black pepper isn't just for flavor. It helps the body absorb curcumin better, so you can actually get more of the benefit. When you add honey, it's the perfect finishing touch. Honey naturally coats the throat, which soothes irritation and reduces coughing. But what's really cool is that studies, including ones published in Pediatrics and backed by the World Health Organization, have found that honey can work as well or even better than over-the-counter cough syrup for nighttime cough relief. And here's why. Honey is a natural demulcent, which means it forms a thin layer over the throat that calms the nerve endings, triggering the cough. It also has mild antibacterial and antiviral properties and antioxidant properties that support healing. And the sweetness helps trigger saliva production, keeping the throat moist. The AAP supports honey as a safe and effective option for kids over 1 year. Just remember, never give it to babies under 1 because of the risk of botulism. I like to make golden milk or haldi doodh with 2% or whole milk because the fat helps absorb the turmeric. You can also use almond or oat milk if that's what your family prefers. I add a pinch of cinnamon to warm the body and ease sore throats, and sometimes a bit of ginger or cayenne, which can thin mucus and help clear a stuffy nose. But if you don't want to go all out with golden milk or haldi doodh, keep it simple. You can give a spoonful of honey straight or use a syringe to give it to little ones over 1 year. It's quick, safe, and still does the job. And here's my pediatrician mom tip I do not want you to forget. At the first sign of illness, runny noses, sneezing, start these remedies. Saline spray, golden milk, or honey if your child is over 1 year of age. This can help reduce that virus from actually evolving. And again, there's no clinical study that shows that that can happen, but this is what I see from experience. And also, if your child is sick, but you are not, it's okay to start the remedies too. When my kids are sick, I make sure to get rest, but I also start to take golden milk to prevent and hopefully reduce my chances of getting sick. I'm linking my full recipe right here to golden milk or haldi doodh so you can make it step by step at home and tell me how you like it. Now let's talk about the little extras that can make a big difference for many children. First, a humidifier. If the air in your home is really dry, adding moisture can help loosen mucus and soothe irritated airways. Dry air makes the throat scratchier and the nose stuffier, so a humidifier can make breathing and sleeping easier. That said, there's nuance here. Some parents swear by humidifiers, others feel it doesn't do much, and honestly, both can be true. Every child is different. If your child has asthma or allergies, use it with caution because too much humidity can actually worsen symptoms, especially if your child has a dust mite allergy. And if you do use one, make sure you are cleaning it well every day to prevent mold or bacterial growth, which can actually make symptoms worse. In our house, the humidifier helped my son a lot when he was little, but my daughter doesn't seem to need it. Every kid's airway and comfort level are unique, so trust what seems to help your child. Now let's talk about Vicks or menthol rubs. For kids over 2, regular Vicks Vapor Rub can give that comforting feeling of breathing easier. For kids under 2, there's a baby version that's much gentler. Here's the difference. The regular version, which I love, contains camphor, menthol, and eucalyptus oil. That's what gives it that strong cooling and vapor sensation. The baby version leaves out the camphor since it can be irritating or unsafe for very young babies. Instead, it uses milder ingredients like aloe, eucalyptus, and lavender, which are safer for sensitive skin and still give that soothing scent. Now, scientifically speaking, menthol doesn't actually open up the airways. It tricks the brain into feeling like breathing is easier. That cooling sensation signals comfort and can help kids relax and rest. So yes, some of that benefit may be placebo, but a safe placebo that brings comfort and calm still has value. Sometimes comfort is the medicine. If your child has asthma, always run products like this by your clinician first, since strong scents can sometimes make breathing harder for sensitive airways. And before using any chest rub, do a quick patch test on the arm or leg to make sure that there's no skin reaction on your child before applying it more widely to their chest. And now the 2 big non-negotiables, hydration and rest. Hydration keeps mucus thin so it's easier to clear, and it helps the body regulate temperature and fight infection. Popsicles, soup, water, juice, whatever they'll take works. And sleep is not an option when kids are sick. That's when the body does most of its repair work. During sleep, the immune system releases proteins called cytokines that help fight infection and inflammation. So yes, your child might wake up more when they're congested, but let them sleep in, drop the schedule, and let their body rest as much as it needs. And if taking care of a sick child makes you feel anxious, which is incredibly common, you're not alone. I actually did a full episode on my podcast about managing health anxiety. It's a great listen if cold and flu season tends to spike you into worry. Comfort helps healing for kids and for parents. This one's easy. I don't use over-the-counter cough syrups in my kids. For kids under 6, studies show that they don't actually work and they can cause side effects like agitation, drowsiness, or even accidental overdoses. Between saline, ibuprofen, honey, and comfort measures, there's no need for them. Even in older kids, the evidence is weak for cough medicine. Sleep and hydration do far more to help the body recover than any syrup on the market. That said, I'll be transparent. I have had a bad cough and sometimes can't sleep, and I'll sometimes take NyQuil or a generic equivalent. But I'm clear on what I'm doing. It's not fixing the inflammation or helping me heal faster. It's mostly just helping me fall asleep. And while rest is important, that's why I believe so strongly in remedies like honey and golden milk. They actually soothe the throat, calm inflammation, and support the body while it heals. So hopefully you feel better faster and are attacking the root cause of that inflammation. When your child is coughing through the night, it's tough to watch. But remember, cough is a natural reflex that helps clear the airways. Suppressing it isn't always helpful. If your child is older and you're tempted to try something like cough syrup, talk with your child's clinician first. But in my experience, the basics, saline, hydration, honey, and rest, are more than enough when you use them consistently. When my kids were under 1, it was the same strategy, just no honey. I used saline spray, gentle suction when needed, baby-safe Vicks, and of course breast milk or formula for hydration. Like I mentioned, my son wasn't sick as an infant, but with my daughter, I would run a warm shower in the bathroom and just sit with her in the steamy air for a few minutes. It's what we call a steam shower. It's simple, but it really helps loosen congestion and make breathing easier. Babies breathe mostly through their noses for the first few months, so even mild congestion can make feeding and sleeping harder. And remember, some coughing or congestion at night is normal when a baby has a cold. It doesn't always mean that they're struggling to breathe. Those early days can feel endless when your baby's uncomfortable and you can't explain what's happening to them. But truly, the basics do go a long way. If my kids wake up crying when they're sick, I always assume something's bothering them physically first. If they haven't had a pain reliever in a while, I'll usually give ibuprofen or acetaminophen if they're due. Chances are the discomfort or pressure from congestion or illness woke them up and they're uncomfortable. Then I'll check their nose. If they sound congested, I'll use saline spray and clear it gently so that they can breathe easier. And after that, it's all about comfort and reassurance. When my kids were infants, that often meant rocking them or holding them until they settled. Babies sometimes just need that closeness when they're not feeling well, even if they're an independent sleeper. As they got older, comfort looked different. Sometimes just a quick back rub, a kiss on the forehead, or a quiet, "You're okay, you can go back to sleep." When our children were in cribs, we never brought them into our bed when they were sick, but we kept an extra bed in their room for those rough nights. That way we could stay close enough to comfort them while still keeping their sleep routine and location intact. It's a balance, providing reassurance without creating a new habit that's hard to break once they're better. My son now is at the age where he's happy with the kiss and leave version, while my daughter still needs more hands-on comfort. Both are normal. Every child's sleep and comfort needs change as they grow, and what matters most is that they feel safe and supported through their illness. Now, when would I call a pediatrician? For me, it's a little different because I am a pediatrician myself, so I'm able to monitor things closely at home. But if your child has trouble breathing, isn't drinking well or making wet diapers or urinating, is unusually sleepy, or if the cough is causing difficulty breathing, or if the fever is persistent, it's time to give your clinician a call. And remember, I have so much content here on my YouTube channel to help you when your child is sick and hopefully save you a copay. So make sure you subscribe and binge watch those episodes. So here's the recap. For coughs and colds in my house, it's saline, ibuprofen when needed, honey or golden milk if over 1, comfort measures like humidifiers or Vicks, and lots of rest and hydration and comfort. That's it. And I'll be honest, when I get sick as a grown woman, I do the same things. Golden milk, saline spray, ibuprofen, and yes, sometimes I even take my kids' berry flavored ibuprofen because it's right there in the cabinet and it works quick. The bottom line, you don't need a medicine cabinet full of syrups and supplements. focus on comfort and monitoring their symptoms. If you found this helpful, please hit that thumbs up sign and subscribe for more pediatrician, mom-backed parenting, health, and development content. Share your family's favorite comfort remedies in the comments below. I'd love to hear them, and ask any questions as well. And don't forget to binge watch the rest of my channel because I'm here to support you. Stay well, and I'll see you all next time.